We are redeemed. Be redeemed.
What a great privilege to be here once again on Dove Television. You're on to Healthy Living, a program always dear to us in our hearts to educate everyone, thousands, millions of souls watching us. Wherever you are, any part of this world, if you just tune to Dove Television, it's Healthy Living. It's all about your health. Your health is very important to us. That's why we're always here to educate you, to inform you what you need to do in order for you to stay focused and to stay fit. So I want to say welcome. You can get to watch Dove Television on all social networks, like us on Facebook, Twitter, us. Get to watch exciting and interesting edition of Healthy Living and all the program on our YouTube channel. Be Dove Television family, we'll be glad to have you on board. I have a special guest here with us in the house. Remember, in our last edition, we had Professor Millicent from University College Hospital. She was here to talk about breast cancer, and which was very educative, very informative for everyone that listened. And we thank God that we had her on this program. Well, today happens to be a special day. It's a special edition of Healthy Living because this month of March is a month that is dear to us in the Redeemed Christian Church of God, coupled with Daddy's birthday, celebrating with him. And we decided to make Healthy Living a special edition in this month of March. That's why we said we have professionals in the house coming to let us know what we need to know about our health. We have a professor that specializes in kidney, a nephrologist, and he's here with us. He's from the university. He's a professor in the University of Ibadan and also a consultant to the University College Hospital. We have Professor Ayodeji Arije in the house with us. Thank you so much, sir, for coming on this program. I don't know who is going to pay. Is it, we have a Deji in our we have a Deji in our studio. We also have a professor. So definitely don't be surprised when Deji will decide to just tell us, okay, I want to be a professor in camera.
That would be great.
That would be definitely great. Yeah. Thank you so much for joining us. And one more thing, he's also a pastor, a provincial pastor in the Redeemed Christian Church of God. That's Oyo Province too. So whoever comes on this platform, definitely you know that we bring people in our own domain. Yes, the Redeemed Christian Church of God have a lot of intelligent people coming on this platform to inform us, to educate us. So please tune to Dove Television always just to be educated and also to be informed. Thank you so much, sir. I want to say thank you for coming on this program. It's called our hot seat, but the hot seat of the Lord. The Lord is your strength.
You are welcome.
All right, before we proceed into today's topic, we'd like Professor Ayodeji to please lead us in a short prayer. Thank you, sir.
Okay. Father, we thank you for this opportunity.
Thank you, Lord.
Thank you for bringing us together for this meeting.
Thank you.
Thank you because of the information and knowledge you want to pass on to your people.
Amen.
I said that thanks in Jesus' name.
Amen.
We pray, Lord, everything we'll do this morning will be to your glory.
Amen.
And your name only shall be glorified.
Amen.
In Jesus' name we pray.
Amen. Thank you so much, sir. All right, please come along with us because we'll be looking at a topic that is very important. I always say on this program, always be your brother's keeper. Help someone out there. You never can tell. We're looking at the issue, kidney. Kidney is broad. Kidney disease, we had people saying, this person had kidney failure, this person went through kidney transplant, a lot of times. And when we look at the age, sometimes we even wonder, as young as he is, as young as she is, what could have happened? Is it the lifestyle, the food you eat, or what does it, you know, let's gather around together and get the knowledge we need to get, the information we need to get, and also to help other people around us. Sir, thank you so much for coming to impart knowledge to us, for coming to give us information to let us know that there are key things, key factors we need to know about our health. And kidney is something that is rampant these days. Both the young and the old are being affected by this disease. So please, sir, tell us, what is kidney disease, or what is kidney generally?
Okay. I want to put some things straight. Kidneys are two organs that God has made and put in the body to help control the internal environment of the body, and also to produce some things like blood. It produces something that enhances blood production. So those are the kidneys. There are two. But kidney disease is when an affliction comes upon the kidneys. It could affect one, but most of the time the affliction affects both. And that's why when an affliction comes upon the kidneys, it ultimately results in failure, if not attended to very early. Like I said, there are so many things that can cause kidney disease. And if you want to go on this, it may be a very long list. But I don't know, you want me to begin?
Yes, sir. That's why we said we want to get the information.
Right.
We want to understand what's the actual cause, what is kidney, what can we do to avert or to prevent this disease?
Before I go on to the disease per se, let me talk about the kidneys. And I want to also mention that it has worldwide relevance, because this time last week, Thursday last week, the whole world was celebrating the World Kidney Day. And the theme for this year is kidney health. So we want to talk of normal kidneys, what they do, and they have to maintain them in that situation, which means keeping them in health. And the kidneys, like I said earlier on, take care of the internal environment of the body. You eat, you digest your food, you absorb it, you process it. The waste must be discarded. In physical terms, you flush it out through your water closet. But in the human aspect, the kidneys get everything out through your bladder and your urina outside of the body. So that's what it does. You take some other things that may be even toxic to the body, the kidneys break down the toxins and get rid of it. So that in that way, it keeps the body in a constant medium, that it doesn't fluctuate. It's very, very precise in action. Apart from that, it also helps to produce some chemicals that enhance blood production. So when the kidneys begin to fail, those chemicals also reduce, and then you find out these people become anemic. They may have the normal bone marrow, everything, but the stimulus to make the bone marrow function is produced by the kidney. And when this begin to reduce, then the blood production drops. So when you begin to see people who have unexplained anemia, you cannot really find a cause for it, quickly go and check the kidneys. The kidneys might have already been in trouble.
Anemia?
Yeah, that's looking pale, that they don't have adequate blood, and it's not that they are vomiting blood or losing blood or not eating well or maybe having worms that can take away their iron. Then check the kidneys, because the kidneys might have been failing. So that's for the kidney. Now for the diseases that can result in kidney failure, worldwide, especially in the Western world, diabetes is #1. But in our environment in Nigeria, infections or infectious conditions and hypertension, the two of them, they really have been going hand in hand for many decades. Yes, for many decades, that you really cannot say this is the topmost, this is the topmost. But the two of them, in most studies we do, no, not really working hand in hand. Most studies, so we find hypertension as the topmost, so we find the infections as the topmost, but that's just the way it's been going for a long time. One would expect that as we develop and infectious diseases are reduced in our environment, then infections as cause of kidney failure should reduce. But again, that's not been fully established as of now.
Why?
So well, because it's still rampant in rural areas, and even in the urban areas, many people are still living in a substandard life. So they are still exposed to infections that can affect their kidneys in one way or the other. Now, there are other things, like I mentioned, diabetes now is coming as #3 on the list of most studies that we do in this environment. And this is because our lifestyle has changed. 30, 40 years ago, it was way down on the list. But now it's coming up. And when we look at 100 people with kidney failure, you find about, you find diabetes being like #3 among the causes. So it's something coming up rapidly, and again, that means we really need to look at the epidemiology of diabetes and see how we can reduce it as a way of reducing its affliction upon the kidney. So there are other things like obstructions to the urine flow, and many things can cause obstruction. Kidney stones can cause obstruction. Injury that can result in healing with fibrosis. Strictures can also lead to obstructions. Prostate enlargement can cause obstructions. In women, big tumors in the pelvis can press on the bladder and the ureters and cause obstruction. So many things like that can cause obstruction. But then when it happens and you find people are not able to pass urine well, again, they should be checked quickly and find out whether it's already affecting the kidney. Yeah. Now, when an obstruction is affecting only one side, the symptoms of kidney failure might not show, because the patient might not go into kidney failure if one kidney is still working well. But the side obstructed, the patient will show signs of pain on that side of the abdomen, and there may be some swelling. And if it's quickly detected by x-rays and other special tests, the obstruction could be removed and the patient's kidney could still be salvaged if done early. But sometimes once it's extended beyond a certain period of time, it may not be salvaged, but then it may not progress. The disease, the damage may not progress. So the patient could still have some function of that kidney. Maybe instead of 100% function on that kidney, maybe operating at 40%, 30% plus the other good kidney. So it may never really come up as a patient with kidney failure. So for you to have kidney failure per se, the two kidneys must have been involved.
Okay, we just want people to have a clear understanding of what we're discussing here. So let's just have a view, an image of how a kidney looks like, and so that people can get to see what the doctor explains. So please, my director over there, let's have a view of what the kidney looks like, and so a bit of a good understanding and a good explanation. People can be able to understand what we're saying. Okay, sir, please, once the image is on, we'll get to that.
Yes. Well, these are the two kidneys. I said earlier on, God made two kidneys, one on each side, normally. Because sometimes they could be in different locations, but that's an abnormal situation. And the image you are seeing is a section.
Okay.
Like you've cut the two kidneys from top to bottom.
Okay.
So we are seeing from outside to the inside.
Okay.
Of the kidneys, the two kidneys. Okay. The string-like structure coming down, they are the pipes that take the urine from the kidney to the bladder to be expelled outside. Okay,
okay, that's the pipe then.
The pipe, yeah, we call it ureter. Ureters, yeah.
Okay, can we see other ones? Can we have more of this kidney pictures display right there?
Yes, now this is a closer detail of the section of the kidney. It's been sectioned from top to bottom. You could see the ring of red is like the covering. But immediately below that covering, you could see another paler outline around the top, the edges. That's what we call the cortex. Cortex meaning the upper part. And then below you see some stripes coming down in small streaks. That is the medulla. That's why you have millions of tubes, like one of the tubes is what you have seen on this side, the yellow tube coming down. There are in the kidney, you have 1 million of that, average of 1 million. And the red part of it is what we call the glomerulus. It's the one that does the filtering. So it filters the blood, and urine comes out of it into the nephron, and then goes ultimately into the pipe I showed you before.
Now, let's talk about these causes. Generally, you said there are so many things that affect the kidney, and we just need to know, what are these things? Is it the lifestyle? Is it what we eat or what we drink, or what are the things that we consume that...
Okay, we want to talk about lifestyle. Yes, lifestyle could lead to a disease that will affect the kidney. For instance, if you eat just everything, you are not conscious about what you eat, especially animal products. Lots of meat, lots of animal fats, and so on. Your cholesterol level could go up Your uric acid level could go up. These are chemicals that are normally present in the body at a certain level. But when the level goes up, it begins to affect your blood vessels, generates high blood pressure, and that blood pressure goes ahead to damage those kidneys you saw there. So that's why hypertension could be related to lifestyle and could affect the kidneys. Now, there are other things that we take in many of the products, especially preservatives, we don't know, that could be toxic to the kidney by the time they have been broken down in the body. And many of them could, over a long time, call it chronically, affect the kidneys. And you can see the kidneys dying slowly over years, may even be 10 years, 20 years, 30 years.
Slowly, gradual process.
Yeah, and this dying slowly means each one of those small units I showed you will be knocked out one by one, maybe. Gradually, they are going off. And as they go off, the filtering function of the kidney drops gradually. And unfortunately, this disease doesn't manifest on time. People could have it going down until the function of the kidney drops to about 15%. 15 minutes per minute.
But there should be just like a sign in your body that is telling you that something is wrong. You can feel it, but it's like maybe you're fighting and I'm still okay.
Yes.
You know, sometimes when you feel something, you're like, I'm feeling somehow, but I don't know how to explain it. Even when you see your doctor, they're like, okay, can you just take a rest?
Yes.
You know.
One of the common signs or symptoms, let me use symptoms, would be like feeling fatigued unnecessarily, feeling tired unnecessarily. This may not be a direct presentation, but an indirect one, because number one, the blood is dropping. I've told you the blood production will be dropping. And then you may find the person is pale, but nothing really is showing. Blood pressure could begin to rise up. And when the blood pressure begins to rise up, you may be feeling the heart beating. That's palpitations. And those are just indirect presentations. Those things could take the person to see a doctor. Doctor, I'm feeling like this, I don't know what's wrong. Many times they will be treated for malaria, for typhoid, for vague things and irrelevant things. But they find out they are not improving until maybe a specialist or somebody who thinks beyond the ordinary says, let's do your blood test. And they do what we call blood chemistry. In the blood chemistry, the urea will be high, the creatinine will be high. A simple thing could even be, let's look at your urine, which anybody can do anywhere. And then in the urine, they may find there is protein in that urine. That will be the first sign that we find there's some problem with this kidney. Let's go further and evaluate further. So those are the ways they can present until very late, like when the urine production, we measure in millimeters per minute, the way the kidney produces the urine. When it has dropped to like 15 mils per minute, that's the time most people will have florid symptoms. But before then, everything will be vague. And that's why we call it also, it's a killer disease, silent killer. Because it is there for many years, unless you do a check. And that's why, again, we advocate that people should be doing a blood or a general body check every year. Test the urine, test the blood.
Many times people get to run away. They say the money aspect, the monetary aspect.
Testing urine for protein and maybe other parameters that may be abnormal costs about a maximum 100 naira. Because this chip is about 100 chips costing 1,000 naira. And in most laboratories, maybe 100 or 200 naira. Maybe considering other things you will use, even let's say 250. If you do that once a year, I don't think it's too expensive.
It's too expensive for you.
But unfortunately, people just overlook it. I believe it's just that people overlook it and think it's not necessary. But it is very necessary
that we go for that.
Yes.
This is very interesting. A lot of us are, I would say we know, just like you said, we're ignorant about some certain things. We just felt, is it necessary to go for urine test? Do I need to test my urine? I'm okay now. As long as I'm eating, I'm feeling fine, I'm looking good, I'm fine.
Yes.
Now, I want to ask this next question because it's good to seek for more knowledge. Stroke and kidney. What does kidney has to do with someone having stroke?
Okay, maybe I would say, what does
stroke has to do with someone
either way it can be. Because a common cause of stroke is high blood pressure, hypertension.
Okay.
And a common cause of kidney failure is hypertension. So they have a common denominator in one of the causes. So people who have high blood pressure, I've told you, it could emanate from wrong lifestyle, eating habits, and so on and so forth. And those things are what will lead to high blood pressure. On their own, they could have some effect on the kidney. But once the blood pressure starts to go up, I've told you, it's one of the commonest causes of kidney failure. And at the same time, as the blood pressure goes up, the patient could rupture a vessel and develop a stroke. So the same thing that can cause the stroke can also cause the kidney failure.
It's good that I asked. I was just wondering that, okay, if this can cause this, definitely. So that's why I said it's good to always seek for more knowledge. A lot of times, you said ignorance. We'll look at mere little things that we can get to. Some might even say, I don't want to know. I know I'm fine. But it's better you know. It's better so that you can correct your lifestyle. Yes, and do something fast.
And there are things that can be done about it.
Are there other factors too?
For
kidney,
I've mentioned infections. Maybe people can develop some kind of sore throat, but mostly in young people, young children, school-age children. Some of the bacteria that cause the sore throat, they cause a reaction in the body that directly affects the kidney. And that's why I said those are the ones that can be among the first causes of a kidney failure, yes. The legs will begin to swell, the face will swell, abdomen will swell, there are retaining fluid in the body, because the kidney is no longer able to do that. It could start as an acute thing, which if detected early and managed properly, could resolve. And then the kidney function could revert to normal. But when it's not done, it becomes a kind of smoldering fire. The swelling may go away, but the protein is still being lost in the urine. And that's why checking the urine is very, very important. You may have no other symptom, just that there is protein in the urine. And that's like a smoldering fire for years. Because
so once you check your urine and there's protein in it,
you must see a doctor.
You must see a doctor?
Yeah, you must see a doctor.
Okay.
Because they must do something about that protein. Of course, it's not all the time we'll be able to do something completely. But at least one knows there will be measures. We call it preventive measures. That somebody who has a disease that is affecting the kidney, you can take what we call secondary preventive measures. Because something primary has already affected the kidney. So the secondary measures will be things that can hasten the decline of the kidney function. Like if you have high blood pressure, that high blood pressure must be treated and corrected. There are some drugs you must not touch, because taking them will hasten the acceleration, will accelerate the progression of that disease. So somebody who had it could have lived for 30, 40 years, if he's just careless with himself, could find out in another 5 years he has gone. So there are secondary preventive measures that can be taken. Diabetes, if he has diabetes, that diabetes must be well controlled. When diabetes is well controlled, then we've had evidence that it can reduce the progression or even halt it. Yes, if it's well controlled. But some people are diabetic, they don't care, they say they are okay. The sugar level is high. The high level of blood sugar is a danger sign to the kidneys of that person.
A high blood
high blood sugar, yes. Okay. Uncontrolled blood sugar. It's a signal of damage, progressive damage to that kidney. So those are areas, in short, there are so many other things, but it should be taken, dealt with on an individual basis.
So now everyone should go for urine tests. I think it's very important now.
And at least yearly.
Yearly. Is it once in a year? Or?
Once in a year. If it's clear, then it's okay. But in the coming year, still do it.
Okay.
But if something is found, of course, the physician will know what to do.
To attend to the person very fast. So I think this is something we all need to just take our time to go and do it. The work will definitely go on. If there's anything wrong, work will go on. Sure. But just try as much as possible just to make sure, okay, I'm okay in this area. My health is fine. I'm perfectly fine. I just want to thank God for good health. So let's check our urine. Let's try as much as well. Even take the children, right? The children can also... Is there any age limit?
No, well, we've seen people from 1 year, 2 years who've had sore throats that led to kidney damage. But most of them, if managed on time, they respond well. It could be 6 years, 7 years, and so on, but it spans life. But the cases we see with chronic, that is the time that we find most of them in the productive ages of the year, from 20 years to 50. That's the range where we have most of our patients with the chronic. And most of them, if they are not dialyzed, well, that's one part of the treatment. We are not talking about treatment now, but it's one kind of treatment, artificial treatment. If they are not, or given a new kidney, that's by transplantation, they hardly live more than 2-3 years. Once they've reached that end stage, they need a replacement.
So if one of the kidney is damaged, you can still go on with the other one?
Yes. Again, that's another thing.
What's the percentage? What's the assurance of that person surviving on one?
He'll do well. People donate kidneys. They donate one kidney of their good kidneys to maybe a relation who has kidney failure, and they live well with the other kidney. But before it's done, we normally check the 2 kidneys because the functions may not be equal on both kidneys. So we normally don't take the better one. The better one is left for the. But normally they are okay with one kidney.
Normally we can still function well with one kidney.
Yeah.
All right, thank you so much, Professor. This is a very important message given to us. It comes, will I say freely? Yes, from Professor, coming to us, yes, freely. And this is something that I said Dove Television will always do to everyone watching us any part of this world. But at this point, we would like to go on a quick break. When we come back, we have Professor Ayodeji still with us in the house. The phone lines will be opened up for you to give us a call and ask your question. We'll be right back. Please don't go away. Thank you.
Open Heavens International Center. I believe that what you see and hear here will arouse your faith and your life will never remain the same. Challenge God using what you see here as a point of contact to your miracle.
Welcome back. Thank you for joining us again. Just in case you just tuned to Dove Television, we've been with Professor Ayodeji Arije, a professor in the University of Ibadan and also a consultant at the University College Hospital, who specializes in nephrologists and nephrologists. Yes, when it comes to kidney. We've been looking at this topic because this is what we want people to understand, that part of what we do here is to pass your information, give information to people so that you can learn to see, okay, what are the things I need to know about my health? What are the things I need to do? As a person here, I'm guilty of something. This urine test now, I'm thinking within myself now, I just have to go for it. I have to go for it. not the money, not the monetary aspect. This is something that is just a little token. You take a little token and you go for this urine test and be rest assured that I'm fine. I don't have protein in my urine. If there's no big issue. Let's not raise fear. I don't want to raise fear in the heart of anyone. But just go for this test and be sure that, you know, the Lord is our strength in Jesus' name. I'm guilty of that, so I'll definitely try as much as possible to do that. All right, the phone lines will be open up for you to please give us a call. The number to call will be displayed right there on your TV screen. But remember to mute the volume. Tell us where you're calling from, your name, and please just go straight to your question. Doctor, before we came back on air, you were saying something about having a gathering of people, creating awareness of the kidney day awareness. So please tell us more.
Yes, I said this time last week, the whole world was celebrating World Kidney Day. And for our part in Ibadan in usage, we are trying to form a group, Kidney Health and Kidney Care Society, that will comprise of doctors, nurses, public health nurses, nutritionists, the patient themselves, relations of patients, and normal people, because we're talking of kidney health, and that means taking care of the kidney, either in disease or in health.
You talked about people getting to their age, 60, 61.
Yes, because elderly people, again, are very prone to insult to the kidneys. And insult can come in many ways. The drug, if they use drugs arbitrarily, they don't know it can affect the kidney. Because from the age of 45 onwards, every year, the kidney loses 1 ml per minute of what I've said, of its function. So by the time such a person reaches 65, 70, you can calculate how many he has lost. But then for him, it's normal. It's like a normal thing, although in function, it is less. So a person needs to reduce all he has been coping with in the past, like what he eats, what he uses. He has to watch it, in short.
Okay, we have our first caller. Hello? Hello? All right, please, when you call, don't listen to your television set. There's a bit of delay in transmission. Please, just tell us your name and where you're calling from and go ahead and ask your question. Thank you. I appreciate that. Hello? Hello? All right, we lost that call there. It's live coming all the way from Dove Television. Please connect with us. Mute the volume on your TV set. Hello?
Hello, good morning.
Thank you so much for calling, ma. Please go ahead. Your name and where you're calling from.
My name is Blessing.
Okay.
Please, I'm calling from Abuja. I have to ask the professor a question. 3 years ago, I went for urine test. Hello?
Yes, we can hear you. Please go ahead, Blessing. 3 years ago.
3 years ago, I went for a urine test. And they told me that there was protein in my urine. But they did not give me any treatment. They just said I should go off animal protein. They did not give me any treatment. And they did not say anything. But now I'm hearing that protein is not a good sign. That's what I want to know what to do. Because they did not give me anything. They just said I should go off protein and meat. So I'm afraid now for what the professor is saying. I want to know what to do, please, Professor.
Okay.
All right. Thank you so much, Blessing from Abuja. Don't be afraid. Don't worry. Eh?
Okay, Blessing, don't be afraid. I know you could be anxious, but don't be afraid. All we've said today is not to scare people, but to make people to be aware and to be on their guard. Now, if you have protein in the urine, there are so many things that could be found. So I don't label somebody as diseased until we've repeated it. I don't know how many times they did your own, but you should have done it a few times, maybe 3 times consecutively over a period of time. If it's still persisting, then that doctor should refer you appropriately to see a kidney specialist who will know what to do next. They have to do some tests over your kidney, and then, if possible, they will do what we call a kidney biopsy. It's a tiny test done with a needle, and then they look at the nature of your kidney under the microscope. And then if it shows something that needs treatment, there are things that can be given. But there's no point giving you those things without knowing the nature. Some of them are even, we call them benign. and we need to find out to be sure that the kidney is truly diseased.
All right, we have another call. Hello? Hello? Yes, sir. Thank you for calling. Yes, we can hear you.
Thank you. I have my own issue is on urine. Anytime I pass urine, my urine is always, should I say, yellowish in color, yellow like that. Yellow.
Yes,
okay.
we can hear you.
So, yes. Anytime I pass urine, I discover that my urine are always yellow. And sometimes I feel some kind of pain around my pelvic, just by my back like that, somehow. And I try to check what is wrong. So I don't know if the professor can help in throwing more light.
Yes, sir.
All right, thank you so much, sir.
All right, so I would have loved to know your age, if maybe 60 and above. Can you hear?
No, yes,
Yeah.
it has gone off.
Oh, it's gone off. Okay. Well, if you are 60 and above, then I want to advise you to make sure you drink
Lots of water.
well. Even if you are below 60, we still advise, because our environment is very hot. I don't know where you are calling from, but some parts of this country are naturally very hot, and we sweat a lot. So when you do that and your kidneys are doing well, what the kidneys normally do is to concentrate the fluid in your body. They will concentrate your urine so as to conserve fluid for your body, so that you don't get dehydrated. But it can reach a level where the dehydration will now set in. So when it happens like that, drink water freely, and then you see your urine will increase and the color will change. Having deep yellow color of the urine really shouldn't be a sign of, an alarm. Unless maybe there's a problem with the liver and there is jaundice. So that one can easily be detected by your neighbors that your eyes are yellow. Such people, their urine is deep yellow, maybe golden yellow. But if it's the ordinary yellowish color that comes with maybe not passing urine regularly because of lack of water, that is the kidney trying to conserve water for your body. And the way of testing it is to take some more water, and within a few minutes you can go to the toilet. You see the color will be paler. That's what I will advise.
Okay, thank you, sir. Hello?
Hello, ma.
Hello, ma. Thank you so much for calling. Please go ahead, ma.
I am Mrs. Kunfa from Jos, Plateau State.
Okay, ma. Please go ahead with your question.
I heard what doctor is saying that my own problem. Hello? My problem is throat. Because I heard the doctor is talking about the throat. And that is the problem I'm having right now. I'm feeling the throat as if it's paining me all the time. And I'm a diabetic patient. So I don't know how. I've never tested the urine.
Okay, ma. Please listen to the doctor, to the professor.
Okay, ma. Let me just start from the knowledge that the fact that you are a diabetic patient. Your urine should have been tested over and over and over again. So I want to advise you, please see your doctor. They should test your urine, because one of the early complications one of the common complications is kidney involvement. Now, as to your throat and the pain, I wouldn't want you to be too alarmed. Check if it's with pain with swallowing, then see a doctor who will shine a light to the throat and see whether it's your tonsil or some other affection there. Now, the sore throat I was mentioning are more relevant in children. As we grow older, our body must have been bashed with a lot of these organisms would have developed immunity against them. And so the direct affliction of the kidney from sore throat may not be very rampant among older people as compared to younger people. So I wouldn't think that that is something that may be affecting your kidney. But if your kidney is having any challenge, it probably is from the diabetes. It's probably from the diabetes, and this should have been checked many times back so that they can caution you on what to do when anybody has affectation of the kidney with diabetes. We must be very careful.
Yeah. All right. Hello? All right, please mute the volume on your TV set. Get to call us, tell us your name, and ask your question. Thank you. Hello?
Hello, good morning.
Thank you so much for calling.
The doctors, they don't have this culture of telling the patient what is really wrong after taking tests. You know, some years ago, my daughter died of kidney failure.
Wow.
And the doctor, they will come, they will do tests. Nobody tells me anything until when it's getting to death. So it's very wrong. When doctors discover anything, let them try and explain to the patient, this is your condition, this is your condition, this is your condition. So that the person will know. But when you are taking it and hiding it for the patient, how will you know all the caregiver to that patient? It's very, very important. I have not been to other countries before, but I've watched things concerning that when the patient is having any ailment, after conducting the test, they will explain to him or her, this is the problem, this is the problem, this is the problem. So I think the doctors in Nigeria as well, we do that for us as well. Thank you very much.
Thank you so much, Ma. God bless you. You heard that?
Yeah, thank you very much. I appreciate your observation and your comments. I want to assure you that I'm a medical educator. We train students both at undergraduate and postgraduate levels. And at both levels now, one of our key or core areas of, of learning is communications. Communications in medicine is part of what we examine them on, both at undergraduate and postgraduate levels. So I believe the coming generations of our doctors, either the first degree or second degree holders, will be getting better educated in the art of communications. I understand what you are saying, and I experience it from time to time. Like I'm doing my ward and I get to a bedside, and the nurses everybody say the relations should go out. I say no, don't let them go out unless the patient doesn't want them around. Let them stay around. Let them also hear what we are talking about, and then they can give us information, or they can help the patient to give us more information which he cannot remember. This is how it's done everywhere. But we have that culture of saying, it's doctor to the patient alone, and all that is changing. And I can assure you that, to start with, I'm sorry for what happened to your child, to your daughter, and the lack of communication between the caregiver and the family. But I want to assure you that all these areas, we have seen them, and we have introduced them into the training, the teaching and the training of both undergraduates and postgraduates in this country. And I'm sure there will be change in the coming generations.
It's good to always give the relatives information that they need to know. Like when, just like what you said, that when the doctor is coming, that's when they want to push the leave this stage. The doctor wants to see the patient. The patient might not have the strength to talk, to speak up, or to tell you that this is. But once someone is beside him or her, that person can be able to relate very, and you can be able to explain as a doctor that okay, these are the things that we need to do in order to help this person's health to get better. I think this is what people should get to learn, and a lot of people are listening to us right now. If you're a doctor, please come out and tell us if this person is having these symptoms or not. And I think there's the other way around too, is they don't know how this person will take the information. Will this person take it well? Some people are not calm. Once you tell them, hey, you know, they just want to create scene.
Yes, not to get me wrong. I'm not saying that we should tell everybody what, either relation or not, what the patient is having, but communicating with the patient. That's what we also call ethics. We are teaching them on both. Ethics will require divulging the personal information of the patient, even to the wife or to the spouse or to the parents, without the patient's consent. So all this will have to be done in an ethical way.
All right, thank you, sir. Hello, you're on to Healthy Living.
Hello, good morning.
Thank you, ma, for calling. Please go ahead. Your name and where you're calling from.
Okay, I'm Rhoda. I'm calling from Benin.
All right, Rhoda, go ahead with your question.
Okay, I want to ask the professor there. And I get better like in November. So I'll be having, after some time, I started having this high BP issue. High BP. Then I was taken to the hospital. They were like, because I'm having restlessness in sleeping, I'm not taking good sleep and the rest. So I was just going to the hospital to come up that is malaria. I was treating myself. I have to do this EU kidney something, but it was okay. But I want to just find out from the professor, is it normal? Maybe I'll be having this fluctuator in my BP. Because this is my third child, and the previous two, there was nothing like that. So I just want to ask the professor. Thank you very much.
You're welcome, ma'am. Thank you so much. We can hear clearly.
Yes. Thank you very much. It's not uncommon to have people developing high blood pressure in pregnancy. Like your first two pregnancies were free of any sort thing. That's a good thing. But by the time you're having your third pregnancy, I will assume your age is now maybe getting close to 40 and thereabout. So from that age, normally, even without pregnancy or whatever, those who have the tendency to develop high blood pressure, it will start to show up. So there are questions they could ask you. What about your parents? Do they have high blood pressure, your daddy, your mommy? Because there are some genetic link between siblings and children. Now, apart from that, some people, we have also discovered that their high blood pressure starts or is related to one of the past pregnancies. And normally when the blood pressure rises in pregnancy, when they deliver, the thing should settle and there should be no problem. But they should still be seeing a doctor. Now where it doesn't settle, that person should not stay away, should be seeing a doctor to check. And when it's now established that the blood pressure is really persisting, hypertension is persisting, then they need to do checks. Check the kidney for abnormality. If there's nothing wrong with the kidney, there may be what we call the essential hypertension. That is, the patient is getting to an age when hypertension should draw in, only that the last pregnancy probably triggered the onset. And it shouldn't be a difficult thing. The only thing is that it must be treated regularly to keep it under control. Otherwise, it could eventually lead to both heart and kidney disease.
Okay, thank you, sir. Hello? Hello? Can you please speak up? No, I can't hear you. Can you speak up? All right. Thank you so much. I really want to appreciate your call. Please, when you call, please speak up. Okay. What if your urine is foaming? Is it also a symptom?
Yes, that's a good thing to observe. Many patients don't take note of it until we ask them. And when the urine is foamy, it usually points to the presence of protein in the urine. And the foamy nature, again, has to be defined. Most people, when you pass urine to a water closet, continuous on the same spot there, there's tendency for it to foam. But in most cases, that foam should disappear within a minute or two. But when you do such and the foam is there and it's a bit copious, and you come back maybe another 40 minutes later to pass urine, you still find that foam there, or something's not there. It's definitely protein in that urine. You should go for a test.
All right. Okay. All right. This person said he or she urine too much, especially at night. She has been tested, diabetes, and free. But what shall I do? I'm 82.5 years old. Ayo from Ibadan. Okay,
82 years old. We have told you what happens naturally to the kidney from 45 years upwards. There is a progressive loss of function. Not in 100% of elderly people, but in a large number of them, naturally the kidney begins to, just like an aging process. Now, if you wake up to pass urine more frequently at night, at 82, there are many things to check. Check the bladder. Check anything that may be causing the bladder not to distend normally. So the bladder that used to take 50 minutes of urine before is now taking only 20. And besides that, normally the concentrating ability of the kidney starts to go down as you grow older. So,
all right. Okay. Take time to come out. Okay, this person is saying that her husband is always taking his time to come out of the toilet whenever he went in to ease himself. What can she do?
Well, you have to ask your husband, number one, how old is your husband? If he's an elder, again, that's one of the features of elderly people. If it's a young man, they need to find out, is there any obstruction that is making the urine to come out slowly? Otherwise, he may want to just ease himself with pleasure.
All right. What are the daily exercises routine can one do to make you look healthy, at least to keep the kidney functioning well?
Well, there are all forms of exercises people have recommended, but a brisk walk, 10, 15 minutes a day regularly is very useful, is very helpful. Other simple exercises like a treadmill, bicycle, ergometer, or maybe badminton, light things you can cope with. But the important thing is do not stress yourself. Do it to the level you can cope with, but make it regular. The regularity really is the key.
Okay. If one has kidney stones, can it affect the kidney from working perfectly?
Definitely, yes, it will. Because the urine will not be flowing out. But I've told you before it can come out as a clinical condition, the two kidneys must have been affected with the stones. A single stone can affect both kidneys if it blocks the entrance into the bladder. Okay. Otherwise, if it's along the pipe I showed you earlier on, it will affect one kidney, but the function globally will still be normal until more than 75% of the kidney has been damaged.
Professor, I want to say thank you for coming on this program. You've given us some vital information which we all need to know right now. I'm sure you'll still come here. I will have to have you coming to inform us on other things that we need to know about our health. Thank you so much. I want to round off this program, but want you, sir, to please lead us in another short prayer just to thank God.
Okay. Father, we thank you once again.
Thank you, Lord.
Because it's your pleasure to bring us here for this program. Thank you for what has gone forth in terms of what we knew. And we believe, Lord, it shall help those who have heard in Jesus' name.
Amen.
And pray, Lord, even for this television station, as they are helping the people, you continue to give them the ability to do more.
Amen.
In Jesus' mighty name, we have prayed.
Amen. Thank you so much, sir.
You're welcome.
I want to say thank you. For those of you that want to get in touch with Professor, you have his details displayed right down your TV screen. Get to call him or send him an email so that you can get to speak with him personally. There are some things that you might not want to say it out, but you can get to call doctor or send him email. If you're calling and his line is busy, please just send him a text. Sir, I need to speak with you on this. This is very important, and he will get back to you. And thank you to everyone who was calling to this program just to hear one or two information or to ask questions. And I also want to say you can like us on Facebook, get to tweet at us, get to place adverts on this program or any of our program you've seen so far on Dove Television. Like us on Facebook, get to watch on YouTube channel. And want to say thank you to all the camera crew in the house. Want to say thank you to the engineers, to my director over there, to the MC, and everyone who has worked together to put this program to make this program come alive. Want to say thank you. Please stay tuned to Dove Television for more exciting programs coming your way. I remain Oluwafemi Odunto. Have a fantastic and healthy day ahead of you. Bye-bye.